Good morning. I'm Monica G, BPT final year, presenting the topic of the effectiveness of queuing of Cadence with ambulation training in hemiplegic stroke patient. This study was done under the guidance of Dr. Pratap Sugantira Babu, principal of Saveetha College of Physiotherapy. This study focuses on integrating rhythmic queuing techniques into stroke rehabilitation, specifically for hemiplegic patients struggling with gait dysfunction. Introduction. Stroke is one of the major causes of long-term disability worldwide. It often results in hemiplegia, which causes serious impairment in mobility and independence. Rehabilitation post-stroke primarily aims to restore functional ambulation, as independent walking is a crucial part of daily life. However, despite traditional gait training techniques, many patients retain abnormal gait patterns. This has led researchers to explore new interventions like cadence cueing. Cadence cueing uses rhythmic auditory visual signals such as metronomes, music, or visual markings to stimulate and synchronize movements, helping patients walk more rhythmically and confidently. Studies have shown that these cues can improve gait coordination, step length, walking speed, and overall walking efficiency. Review of literature. Let me highlight some important studies that support this approach. Ahmed et al. 2023 conducted a randomized controlled trial comparing treadmill training with and without rhythmic auditory cues. Their results showed significantly better improvements in walking speed and coordination in group that received auditory cues. Metcalf et al. 2022 designed a stakeholder informed home-based ARC program using rhythmic cueing. Participants reported enhanced gait and higher adherence, showing potential even in real-world non-clinical achievements. Hutchinson et al. 2020 used wearable sensors in digital therapeutic program to automate cadence cueing. Even after 3 sessions, stroke survivors showed meaningful improvements in walking speed, demonstrating the power of individualized sensor-driven cueing. Nascimento et al. 2015, through a systematic review, concluded that cadence cueing significantly enhances walking speed and stride length. Su et al. 2014 also supported these findings by showing notable gains in gait velocity and balance using rhythmic auditory stimulation. Background of the study. Traditional gait training usually emphasizes strength, posture, and balance, but often misses the timing and rhythm component. Yet, timing is crucial in gait because walking is essentially a rhythmic, repetitive activity. Rhythmic cues can stimulate areas of the brain involved in motor control and neuroplasticity. This is particularly important in the subacute stage of stroke, where the brain's capacity for reorganization and recovery is still high. Hence, I wanted to explore whether adding cadence cueing to ambulation training could lead to better outcome. Need of the study. There is a pressing need to improve the effectiveness of gait rehabilitation despite best efforts. Many stroke survivors continue to walk with asymmetry, poor rhythm, and increased fall risk. Cadence cueing is not only clinically effective, it is also simple, low cost, and can be delivered even in resources limited settings. This makes practical tool for improving outcomes in physiotherapy programs. Aims and objectives. The aim of the study was to evaluate the effectiveness of cadence cueing combined with ambulation training in hemiplegic stroke patients. The objectives were to assess changes in gait and balance using dynamic gait index, to compare pre and post intervention scores within and between groups, and to evaluate statistically significance between the conventional and experimental groups. Methodology. This was an experimental study done as literature review, was conducted at Saveetha hospitals. We used a convenient sampling technique and included 30 hemiplegic stroke patients aged between 30 and 60 years. They were randomly assigned into two groups. Group A, conventional gait training group. Group B, cadence cueing with ambulation training. All participants had DGA scores of 19 or below, indicating a risk of falls and gait impairment. Exclusion criteria include cognitive impairments, hearing issues, uncontrolled medical conditions. The intervention lasted for 4 weeks with 4 sessions per week, each lasting for 30 minutes. Group A, conventional gait training. Group A received conventional gait training, which included heel raises, tandem stands, standing marches, supported leg balance, partial bar walking, and partial squats. These focused on strength, balance, and motor control. Group B. Group B, on the other hand, received cadence cueing integrated with gait training. This included auditory cues like metronome, rhythmic music, verbal instruction, and visual cues such as floor markings, step target training, treadmill training with visual feedback. These focused on rhythmic gait, rhythm, symmetry, balance through multisensory cueing. Results. Let's look at the results. Post-intervention DGI scores improved in both groups. Group A, control group, had a post-test mean score of 19.8, while Group B, experimental group, achieved a mean score of 21.06. The p-value was less than 0.001, indicating a highly statistically significant score between the groups. Although both the interventions had a positive effect, the cadence cueing group showed greater improvements in gait and balance, confirming its additional benefits. Discussion. The greater improvement in the experimental group suggests that cadence cueing activates motor, timing, and coordination centers in the brain. Rhythmic stimuli likely enhance engagement of the sensory motor cortex, supporting recovery even when damage exists. Moreover, because cueing is simple and cost effective, it can be incorporated into routine, rehab, or even continued at home using phones or wearable devices. These results align with existing studies that show rhythmic cueing is effective, adaptive, and well received by patients. Conclusion. To conclude, combining cadence cueing with ambulation training significantly enhances gait and balance in hemiplegic stroke patients. It is an easy to implement non-invasive method that supports neuroplastic recovery. Moving forward, personalizing cues based on patient preferences like music or visual feedback could further optimize outcomes and reduce dependency. This technique holds strong potential for long-term integration in both hospital and community rehab settings. These are the references that supported the scientific basis of the study, including evidence from WHO, Todd, Lanholm, and other leading researchers in stroke rehabilitation. Thank you.